thanks so much for joining us on Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, and today I'm joined by Tim Berry, who is the co-founder and CEO of VillageMD. Thanks so much for being here.
Thanks, Stephanie. Thrilled to be here.
So for the one question with you, I would love to find out why primary care is so important, because it is definitely something that I think there's a grassroots initiative to get back to, where it used to always be the family doctor who was at the table, invited to the family functions, and we kind of got away from that into specialty care. But primary care really is the way back, I think, to true healthcare and true health. So why don't you tell us your perspective about that?
Yeah, so I think as it relates to primary care, Stephanie, the primary care doctor is the individual who is trained to actually take care of the totality of the body, right? And that's something that along the way in our healthcare system we've sort of lost. But with that said, when you look at the challenges of our healthcare system, we have quality of care outcomes that sort of look a lot like third world countries. We also have a cost of healthcare in this country that's 2.5 times that of most other industrialized nations. And then when you sort of unpack it all, part of what you realize is that less than 1 in 5 Americans who have chronic disease constitute 85% of that healthcare spend. And the individual, in our opinion, who's best positioned to actually solve the problems of a society today that is burdened by chronic disease is the primary care doc. And the primary care doc working in concert with other specialists in a tight integrated model that really makes sure that patients don't fall through the cracks, and a model that looks beyond the 4 walls of a clinic and redefines primary care. So it's not just a primary care doc who opens up the door and sees whoever they see, but really a more thoughtful approach to how we look at patients and the level of complexity they may have in their life and their disease, and trying to get in front of it and proactively manage it.
Thank you so much. And thanks for sharing your thoughts on that.
Thank you.
Thank you all for watching. We'll talk to you soon. Bye-bye.